Here we are. So, as always, we have our agreements for the group today. Maybe some of you in your own group start with ground rules, lay of the land, but important to all be on the same page, and especially being patient with technology. I will highlight that one today. Okay, so it is June. It feels like it for sure. So if sometimes we start with a chat storm, so put in the chat, what was your favorite summer activity as a kid? Let's see. Let me guess. Kelly, yours was probably something. Okay, I was gonna guess something involving dogs. Yes. Ooh, reading for sure. Beach reads. Oh, see, I combined Katie and Katie's reading and beach, but you can read on the beach, and then it's best of both worlds. My kids are finally the age where I don't need to be on, hyper alert for danger. So I think this summer I can actually read a book instead of having to be like a semi-professional lifeguard. So I'm excited. We're going to Hilton Head, South Carolina, the first week of July. So yes, yeah, that's down by you, Katie, right? Um, well, that is awesome. Um, our agenda for today, talk about compassion fatigue, have a couple slides and definitions, and then to do a breakout discussion for them. So our usual in sync. And I added a quote that means a lot to me. I consider myself an empathetic person, and so this quote from Song of Myself by Whitman really resonates with me, that it's not just, you see someone and like, oh, poor them, but to put yourself in their shoes and feel their pain and then want to do something about it. That's why I think a lot of you are do the work that you do or the volunteer work that you do. But I share this to start our time together because how tiring is this and how exhausting that as you meet people, you become their pain, you become their suffering. I think sometimes that can be a superpower as a support group leader, to really be able to see the world through someone else's eyes and to feel them and meet them where they are and sit with them in the dark. But for us, doing that, that can be, that can be really exhausting and tiring. And if we are not careful and we don't take care of ourselves, then we can experience compassion fatigue. So, this is the definition of compassion fatigue, and not just emotional or psychological, but I thought it was noteworthy. It's physical exhaustion. One, when we're always putting ourselves in the shoes of the folks that we were taking care of, or we are becoming them, and feeling the pain of what it's like to have your life partner, your spouse of decades and decades, be experiencing a degenerative disease, or for you to have to, if your group is people with Parkinson's, to experience that journey as people are having changes in their identity and their abilities, then yeah, that's a toll that takes a lot on people, and can manifest in a lot of different ways. Loss of empathy, which is so ironic because so often that is why we get into this work or this volunteer work in the first place. And then detachment. And I don't know if any of you have in groups that you've been to, not you, of course, because that's why we're all here, but other groups that you've been to or other settings, sometimes a lot in healthcare. Maybe do you ever get your blood pressure taken by that really burned out MA that just seems so brusque? And it's like, oh, she's having a hard day. I wonder what's going on. So, um, that's exactly why we're all here. We want to talk about it, vent. If you can talk about it, you take away its power. And we have some ideas, and also want to hear yours. What do all of you do to prevent this from happening? So let's see. We have a couple people who have joined late, and I didn't get to say hi. Hi, Judy. Hi, Greg. And just wanted to, let's see, let me go back to my, oops. Let me go back to my screen share. And here we go. Because I can't see your faces when I have my screen up, but wanted to invite you guys to unmute and say, is this something that you felt? Is this, oops, I did it again. Can you still see my screen? Yeah, okay. I figured it out. I can have my screen and your faces at the same time, but wondered if anyone wants to unmute. Have you guys experienced this? Is it tiring to feel all the feelings, to be, part of the groups that you lead? I saw Greg, you came off unmute. What do you think? You experience this sometimes?
I get sometimes irritated at people, you line up speakers, and then one day before they're supposed to speak, they call you and say, I can't speak. Can you find another speaker? That type of thing.
Mm.
Um, I've always kind of looked at it as I am blessed to be in a position to be the support group leaders. I have 9 support groups that I work with, 2 that I run. And knowing what I know about Parkinson's, I see this as a privilege to do this for other people. So I don't get too fatigued, if you want to use that word. I certainly don't get exhausted. I get excited about helping other people. I'll take the serotonin and the oxycontin that your brain produces when you help other people and focus on that.
Wonderful. Thank you, Greg. And I think that's one answer. That's why we get together. So maybe some of us who are, approaching burnout can hear that excitement from Greg and get reminded that, oh no, this is fun. And, and get that shot in the arm. Anyone else want to share who maybe is starting to experience some, compassion fatigue? Maybe you're not there yet, but you can see it happen or have experienced it in another setting.
I can say a word or two. I've been part of the Santa Cruz group for about 16 years now, and as part of that, I have been active in running our monthly meetings, and we have a committee that works on that, and I'm the head of that committee, and I'm getting to the point where I'm getting people in the group to take on some of the tasks that I have been doing, contacting speakers. In fact, I have identified my replacement. He didn't want to accept it yet, but I said I was good for a few more years, and I thought that he would do a wonderful job at doing what I'm doing now. So it's always good to have some people in the pipeline who can take over for you. I also wanted to reflect on what Greg said about how exhausting it is sometimes to get a speaker. I've spent the last year trying to get our local representative from Congress to speak to our group. We're talking 20 emails back and forth. It can't come. It's so frustrating, to have this back and forth and eventually, you know, nothing to show for it. One of the things that seems to help many of our programs are panels of people. And the wonderful thing about a panel is that if somebody doesn't show up at the last minute, you've always got somebody else there as a speaker. We've been very fortunate to get some really nice panels of people to speak to our group.
I like that. So that's a great tip about the speaker no-shows, but then also, Karen, it sounds like by having some succession planning and, term limits, it takes away the pressure. It's not going to be all you forever and, you feel the weight of the world, but have that committee standing behind you. And I think I saw Lauren, you unmuted. Did you have something to add?
Yeah, I was just going to say, I think after doing this for, a number of years, it can be emotionally exhausting, just the loss of people who become friends who, have just gotten older, and whether it's Parkinson's or something else, and they pass away. We see it time and time again. It seems like it happens more and more often. And also not just that, but if they just can't come to the support groups anymore, they're just not able to. That can get tough. And also the support group leader, I think, tends to be the person that everyone goes to when they're having problems. And that can be tough. You're always expected to be on, and you're the person that can help solve the problems. And especially as a person with Parkinson's, you can't always be that way. So it can be tough. And like you said, I think, Karen, having other people there in the pipeline to pick that up is really, really important.
Absolutely. And you bring up such a good point about loss and seeing your friends, the people that you care deeply about, seeing them decline and pass away. This is something that, I don't know if there's any healthcare professionals amongst us or people who are social workers or counselors, but I know from talking to my colleagues that, masters in social work, like you spend a lot of time working on boundaries um, and how to protect yourself as the practitioner. And sometimes as volunteers, we jump in whole heart and uh, can set ourselves up for some bruising. So I think I saw Judy, you raised your hand.
Yeah, I guess I'm sort of expecting that to happen to me someday. But I kind of went the opposite way. After 10 years of being part of a support group, I kind of took it over. and and I'm sort of learning as I go that and I think so far it's been exciting, and I'm I've got a lot of energy because I see the progress I'm making, and I see the group coming together, and actually people are volunteering to help run it, because one of the things that happened before, we used to be part of Banner, and they always had a social worker there kind of facilitating, and now it's our group. And so we're sort of all, and I tried to make that really clear when I stepped in and said I would find a new location and all that. So I don't want this to be my group. I want it to be our group. And it's working out so far. I'm getting a lot of help. I've got a couple of people that'll back me up if I can't be there. And it's been very exciting, but I'm thinking, I'm going to be going along like in Never Land, and all of a sudden reality is out there waiting for me. But so far, I haven't experienced it, I have to say.
That's great. And that might be a good segue to some of, so folks have mapped out the path of compassion fatigue, these steps, and not saying, not assigning any labels to anyone. And again, this is not Parkinson's. This is, much bigger picture, just common pathway for compassion fatigue. And that's exactly why we're learning about it. So we don't fall into the stereotypical buckets. But I will click through these. So starting off with, that super excitement, going above and beyond 100, 110, 125%, all in, ready to go. And then maybe some irritability. Um, Things aren't going as easily as they were at first. Maybe speakers stop showing up and no one appreciates that you are giving it all and staying up late and, taking time out of your personal life to do this, and some anger and irritability creeps in. And then withdrawal, just, okay, I gave it my go. No one appreciates me. Pulling back, I'll walk through the steps, I'll show up, I'll turn on the lights and set up the chairs and get the coffee and, starting to numb yourself. And then full zombie numbness where you're angry at people. What started as such a beautiful creation now is a source of stress. And instead of people coming and, finding peace and connection, there's just this ugliness going on and hopelessness too. And at this point, this is kind of the tipping point where either burnout happens, and in the case of a support group, maybe that's where, it's time to step away, I'm done. The group may fold, you hand over the reins, or compassion resilience kicks in, where start to work on, wait, why did I want to do this in the first place? How, what went wrong? How can I get help? How can I take care of me? And a renewal and a transformation takes place. So this concept of compassion resilience, we talk about resilience in general, but compassion resilience, to be able to, the old saying, you can't drink from an empty cup. How do you take care of yourself, fill your own cup, and that makes you more resilient and more empathetic and more compassionate. So let's see, we had a couple comments in the chat. Okay, thank you. Kelly put some of the that cycle and some of the tools in the chat, but wanted to walk through, folks who study this see the pitfalls of compassion fatigue and where it can get us, and how terrible if what starts as a beautiful service to the community that you care about can really go sour and turn into something terrible. So very important to work on that resilience. That's part of the reason why we have this group first Monday of every month, to be able to gain resilience from each other, get some tips, hear folks who are in other stages or might have some, some clever practical ideas, or just remind ourselves why we do it all. So I did have a question though. When I asked if anyone was a healthcare professional, Katie raised her hand. And Katie, well, first of all, yeah, tell us what is your training and why you raised your hand when I said that.
Sure. Can you hear me?
Yes.
Okay, great. So I'm the outreach coordinator for the movement disorder program with St. Joseph Candler Neurology. So basically, I facilitate different support groups. I do one-on-one case management with patients, and then I also do some education on the actual disorders, on caregiving, on just really a lot of connecting people in the community to different resources.
Mhm. And how do you, how in your training or in your practice have you taken care of yourself so that the folks that you see, decline, or, you don't experience this compassion fatigue?
Well, I think it's really important to just start with the mindset that no matter how many times you've had this conversation, it's the first time for the individual. And that we really want to approach people with this not knowing stance, because I can infer how you might feel based on what other people have said, but I don't know what you specifically are feeling or what you specifically are needing until you tell me. So really, just keeping that mindset that while this is a very shared experience and some things can be familiar from person to person, this is a unique experience to each person. And so I think by kind of having that attitude, that's kept me personally from being burned out in a lot of ways. I've worked with individuals with movement disorders really intensively since 2009, which is why I started this position. And I'm finishing my master's in social work. I'm right at the end. So I have that training, which is extremely helpful. But I'm a caregiver for, a family member now currently who has some really extreme challenges. So that really helps me be empathetic because I'm in this situation myself, not with Parkinson's, but with a chronic, very difficult illness. And so
Mm.
I understand in some ways how difficult it can be.
Well, congrats on your master's.
Well,
And
thank you.
so uh, staying curious, asking questions, not
Right.
becoming that know-it-all of, oh, I've been doing this for so long, and having the answers, having the questions, not the answers.
Right, and everything is changing, and I think you learn so much from the people who are in your group. They're going through this, they have new information, they have new research, they have new ideas, they have new approaches. I mean, a really good group, they just they kind of do it all themselves. They're doing a lot of the heavy lifting.
Hmm. Yeah. Hi, Bernard. I see you raising your hand.
Yeah, I have a slightly different take on this.
Mhm.
And that is I sort of bifurcate support group leaders into two groups, the professional group and the volunteer group. And my challenge with this particular issue is that for the professionals, you can always fall back on, well, this is my job, I'm getting paid. For the volunteer, it's very different. Your pay is that you help people, and so on the job you can ask for a raise, but if you're a volunteer, the raise is that more people are saying you really helped them, and this is a valuable thing. And so it's kind of hard for me to talk about this in simply the abstract without going back to the fact that for volunteers the reward is this. And so when you talk about not being dispassionate, but pulling yourself back, you're talking about like taking a pay cut. You're talking about, I'm just not sure where you go
Yeah, well,
if you're getting
that
burned
is
out.
again a really good segue, that it's not about becoming more dispassionate, and it's not about, putting on your suit of armor and closing off your heart, but it is actively engaging in yourself, in self-care, in how do you actually feel more and empathize more, to prevent this burnout and fatigue, which I think your point that, um, when you are a very skilled volunteer support group leader, your job just gets harder because your group grows and more people come, and
Yes.
maybe it's more complex and it's larger and you have more opinions or more, subtypes of people to deal with. And do you think that's true, Bernard? That
Well, I
it's
know it's true.
you've
And I do
experienced
it. Not,
that?
it doesn't necessarily even have to grow, but you're reaching people who were non-participants before, and you managed to build a bridge for them. And so now they're becoming more dependent on this to keep their lives going. And then so now you've added that to your wagon.
Touche. So it's not more people, it's deeper. Whereas maybe if someone, is just, they just show up and, small talk and listen to the speaker, that's one level. But if they are sharing about their, their hopes and fears and their personal journey, that's a lot more of a heavier lift, is what you're saying. They're
Yes.
engaging.
Yes.
Mhm. So how let's see. So how do we work on that compassion resilience? How do we keep the excitement going, keep ourselves empathetic, prevent that burnout and fatigue and irritability and hopelessness from growing and inserting itself. So we have let's see, we have 16 people, and we're going to take this to a breakout groups for further discussion. And I am very spoiled. Kelly here just waves her magic wand and the breakout rooms happen. So Kelly, are you ready for us to head over to breakout rooms and discuss?
I am. Get ready to zoom on over, folks. We'll get broken up into 2 separate groups, and then we'll come back with about 20 minutes to share.
Awesome. Hi, how was everyone's discussions? I received the feedback, never enough time, so duly noted. Uh, so let's see, we had 2 groups and let's see, Lauren, do you want to share themes, or is there someone else who was keeping a synopsis of what was going on in your group?
Go for it, Greg.
Oh, but you're muted, Greg, so we can't hear you. Oh, we can't hear you though, Greg. Let's see. There you
We talked about a variety of things. We had 2 of the professionals in this industry in our group, and we talked about one particular issue in which, well, it comes up in different ways, but at a person involved in helping in a support group, their husband was suddenly diagnosed with benign essential tremor. And she made the comment at the group, something to the effect of, well, at least he just has benign essential tremor. If he had Parkinson's, I'd divorce him. And so we talked about how do you broach, when someone goes way out of bounds, how do you come to somebody else's aid and come up with some solutions for her? So we talked about that one for a particular time, and Lauren, Deborah, what else did we talk about? I talk, I don't take notes.
We talked about ways of staying fresh and
Yeah.
looking at other support group leaders and other support groups and getting tips and tools for our toolkit for that from them.
Yeah, tricks of the trade. I learned one. I had a friend that had Parkinson's. Unfortunately, he's passed away now, but he had difficulty with stairs and his mobility and balance and everything. And he came up, he was told this by a neurologist. Every 3rd stair, he put a statuette, a little thing. And I live about right by the beach, so I tried the same thing. And I have a big seashell or a bird or a manatee or anything like that. But every 3rd step. And so as I'm going up and down the stairs, in addition to holding onto the railing, I'm looking at those objects to consciously say, I know I passed that one, but I have two more. So I got to keep the rhythm of my going up the stairs or down the stairs in place. And little tricks of the trade like that help.
Love it. Support groups always have such good little tricks and tips, and you can use a plastic bag to get out of your car, and and all kinds of ingenious things that people try and then share. So wonderful. Thank you, group number one. And I poked into group number two, so heard a little bit, but for all of us, anyone from group number two want to share? And I see Karen, you just unmuted.
I'll say a few things, and then we talked about a whole bunch of things. But one of the things that that Judy mentioned is that, well, she set up she had to move her group and is sort of establishing a new group, but she also visited other groups to see what they were doing. And I think it was Andrea who said, we often say that when you've met one person with Parkinson's, you've met one person with Parkinson's. And she said, well, when you've been to one Parkinson support group, you've been to one Parkinson support group. They're all different. We talked about how important it is to have to know what the group wants. The question was asked, well, do you always have a speaker? And people have found it works best when you look to the group and say, what kind of a group do you want? Do you want it to be a support group? Do you want it to be an informational group? Do you want some variety? And the variety is very important. And we also talked about how important it is when you're working with volunteers. And I think it was it Bernard or David that said that, how important it is to make your volunteers feel valued, that what they're doing, that you really appreciate what they do. And then often they're willing to do even more or to continue what they're doing. Somebody else want to chime in?
I'll share one thing that Karen mentioned, that she often does the topic, how to build your care team. And I see a lot of support group leaders who become like the support group mother figure or the go-to where something goes wrong. Oh, I need a wheelchair ramp. Oh, I don't know what to do. Oh, I need a new physical therapist. And the trend emerges, call the support group leader. And that I have to call out, that is a heavy lift. That is a huge burden. That is a lot of responsibility and can really burn someone out and take you from oh, I know all these people, I can help share, where to go for this and where to go for that. But if instead you empower people and the old, teach a man to fish, and how do you seek out an OT and a PT yourselves? How do you use the internet? Um, I wanted to just share that from Karen, because one trend that we see at PMD Alliance is people, you know so much about Parkinson's, you care so much, and you become the de facto go-to. And then sometimes it's at the cost of your own, balance and mental health. And I guess all the cell phone plans are unlimited minutes these days, but I've talked to some support group leaders and they get like, you know, 50 emails a day about this, that, and the other. And this is supposed to be a volunteer gig. So that is also a call out, something that I see, and I want to, not saying that any of you do that, but be careful, be aware of it. And then I missed the beginning, but someone shared a story that resonated with me, that sometimes you just have to cry. Like sometimes, things build up and you feel deep feelings and you meet people and, your heart is moved and it just builds up, and the human body has this great, pressure release escape valve of crying. Maybe for some people that's I don't know, exercise and throwing down a medicine ball, or training for a marathon or something like that. But that sounds like a lot of work. And I don't know, I've always found value in just sometimes a good old fashioned cry just releases things. So I want to thank the person who shared that had happened to them. And then, Bernard, could you share some of what you were talking about how you like it's never one, a support group is never one thing and you gotta, shift and move with what people need. You remember that
Yeah.
line of thought?
So what I was emphasizing was that support groups, we found that successful support groups evolve. So, and they evolve based on the community that they build. And so the idea that you go grab somebody's model for a successful support group and then you just follow it um, is, sorry, is it, it, it's not a winning proposition. You may get lucky, but more importantly, it's just to focus on your community that you built and what they want, and they will evolve and tell you and point you in a particular direction to go with. And you need to be flexible because I know some people. So we put together an alliance of support group leaders trying to reach underengaged communities. And one of the things that we watched over the first year was support groups coming and going. I mean, their leaders still attended our alliance meeting and discussed it, but we learned a lot about what was going wrong, which is helpful too. We're going to publish that in a guide. But what was key was consistently the ones that seemed to fail had a template that they were trying to follow, and they got frustrated when the template wasn't working. And so you got two things going on at the same time. You have the leaders frustrated and trying to make things happen, and you have people leaving. And boy, is that a losing combination. So the important message there is that first off, there's no one support group style, everything that's there. Second is pay attention to your people. And I want to tie back in something we said earlier, because I think it's probably one of the most important things. And that is people will be there if they feel valued. Someone mentioned that they have a support group in which they have a speaker every month, and people just come, listen to the speaker, and then they disappear. That's it. There's nothing else there. I would say that's the first time I had heard that, but I'm not surprised. So that's a group of people who want to come and hear a lecture and go home. And there are those, but the vast majority of support groups have community that's there. And so my advice was for support group leaders to be flexible. Listen, your reward comes from helping people. Although Andrea, I'm taking your admonition. You can't be all things to all people. You're absolutely right, and you can't solve every problem. But I have a good list of here. You wanted more information? Go to this phone number. Go to this website. Yeah, it's a handy tool to have. So hopefully I answered your question that you were
And I
asking.
love that. If you're trying to follow the one way to do a support group, you will tire yourself out. No one will want to come. So, go with what the group wants. Go with what you are good at, what, maybe take from what your career or your prior experience was. You have to be flexible, have to be mobile. And Judy shared she goes to observe a lot of other support groups
Yep.
and learns what to do, but also what not to do. So I think that's an interesting tip.
And let me give one example of being flexible. In interviewing a lot of people that we were trying to get into a support group, we heard one common theme over and over again. They didn't want to attend the support group. When we asked them, why not? They didn't want to attend the support group. So we renamed ours. They don't carry the name. We don't call them support groups, etc. But they come and obviously they function as a support group.
What is the
but
name of the, like, what's a name? How do you name it where it's not a support group, but it is a support group?
so mine is the SIG Barbershop, okay? And because the community, I was trying to reach males in the Parkinson's community. We all know what a barbershop is, and a barbershop is a great support group. It's a great, safe, support environment. So we named it that, and that drew in the males. My wife's support group, Denise, is Shades of Strength. And it was a name picked by the people in the support group because it was meaningful to them. I probably never would have come up with that, but there's an example. So Shades of Strength, and they definitely don't call themselves a support group, even though they are, you know. And that's so that was one of our points, was like, you don't have to attach labels that somebody else thinks is important. What we're trying to do is provide the support, be that place. So we'll take whatever is there. Another set of names we know that have worked for the Black community are the Kingsmen, the Sisters Journey. Oh, it's like, okay, that you know, it's not I'll just pick a spot. It's not Omaha, Nebraska support group, you know. It's not that. They didn't have to have support group in the name. So those are a couple of examples, and we don't fret over it. And in fact, if we do have someone come in to address like an MDS or something, we say, now the one thing I don't want you to do the whole time you give your address is don't say, thank you for inviting me to the support group. They'll have to assassinate you on the spot because they don't want to be at a support group, even though you're just like the one that happened yesterday. You know, yes.
Yes, Nancy.
I had shared it with the group, but one of the groups that I'm involved with, the participants said, we're not living in the solution. No, we're not living in the problem. We're living in the solution. And that became the name of the group. Also, when Bernard was talking about, you know, support group in San Diego, obviously as a border town, we have worked to develop the Hispanic support system as well. And Elizabeth Garces is our contact. Her mother and brother had Parkinson's, her sister had cerebral palsy, and her son had muscular dystrophy. Talk about someone with a history of caregiving. And she left Venezuela when her son was in need of better medical care and came to the United States. So she is our Hispanic liaison. And she said to the community, support group, we cannot translate over. It's like, it just doesn't work. So her group, and I speak Spanglish, so I'm not even going to try. Her group, in English, it means come together. And the same with our mentor program. She said, no, absolutely not. We cannot translate it across word for word because that's like supervisor. And so it's been very interesting to see how it has to be, it's a cultural thing, and how it's going to be palatable for a particular cultural group. There has to be that awareness if you're going to be effective. And finally, it just dawned on me, I'm sitting here dumbfounded. My very first job coming out of undergraduate school was running a halfway house for people low income, dealing with mental illness. And I just now realized, oh my gosh, I used to every day, I lived in my own apartment by the university, but every day I would drive from the halfway house in Hillcrest to my parents' home in Mission Hills. I would not go in, I would sit in the car and I would cry for a half an hour. And then I would get on the freeway and I would drive home. And it never occurred to me that, yeah, I was dealing with compassion fatigue back then. So thank you.
And Lauren put in the chat, thank you, Nancy. Lauren put in the chat, one group coffee chat, another social time. So yeah, so it's not like getting out the thesaurus and looking up, okay, support and group, and it's, you know, anything like that. But yeah, social time. And I know There's exercise group, walking group, potlucks. All of those are undercover support groups. When you're building community and holding space for people to talk, that is a support group. There is no one definition, and that kind of flexibility gives facilitators, gives leaders resilience. It allows us to have co-leaders and other helpers, so that too much burden is not placed on any one person's shoulders. And what a great way to prevent against fatigue. What a great way to build resilience. So wonderful. Well, thank you all for joining us. And it's never too late, Judy. You could always, rename, right? You could just like call for a vote and rename. But thank you everyone for joining us. And we sent out some resources. They were in the chat, and then I think prior when you registered, we sent out some toolkit resources, and we want to hear other things. What else do you do? Someone couldn't join, but they said if you Google compassion fatigue guided meditation, that there's some guided meditations on YouTube, and it walks you through like imagining the burdens of others flying away in the wind and things like that. Or maybe it's coming to this group. How about that, Kelly? That's a good way to plug for next month. Coming to this group, talking to others who we're in it together. We know what it's like. It's the most rewarding, amazing work, but that doesn't mean that it's easy or everyone would do it. So thank you to all of
Andrea,
you for doing the work that you do.
Andrea, real quick,
Yeah.
I need to get with you about coming to my group
Yeah,
and helping me with something. So call me when you can.
absolutely. All right. Well, thank you, everyone. Have a great Monday and a great June.
Bye.
Bye.